Hello, it's Dion here, author of the blog Words from a Black Woman, and today is another In Conversation With. The government announced today that there's going to be a study looking at the impact of the coronavirus on BAME nurses, and this brings us nicely into what today's topic is going to be covering. So I'm going to be interviewing my sister Olympia. Olympia is an NHS nurse and has been for the last 6 years. We're going to talk about her experiences working in the NHS and what racism actually looks like from her perspective. We're going to talk about her own direct experiences. We're going to be talking about solutions and reasons behind some of these things and how we can raise awareness to bring change. This is a topic that's really close to my heart. I absolutely love the NHS. They were absolutely fantastic when my daughter was unfortunately diagnosed with cancer at 1 year old. However, I know that people don't always have the same experiences. So speaking to a nurse who's on the front line hopefully will shed some more light on some of these things. So yes, I am looking forward to this. So introducing Olympia. Hello, it is time for the interview basically. So introducing Olympia, I gave your introduction just shortly before. So with Olympia, she has been an NHS nurse for 6 years now, working in what department?
Paediatric ward, so 0 to 18 years.
Yeah, but I'm assuming that you've experienced other departments as part of your training as well?
Yeah, so mainly all paediatrics, but I do like an outpatients unit. I deal with like cancer patients, diabetic patients, all specialities, but mainly just general peds, so all 0 to 18.
0 to 18,
yeah.
Cool. So today we're going to be talking about racism within the NHS and what that looks like from Olympia's perspective. We're going to be talking about some of Olympia's direct experiences. Olympia herself has a couple of ailments, TTP and TPP?
ITP and TTP. Yeah.
Which are basically blood disorders. So she has been on the other side, on the receiving side. So we'll talk about some of her direct experiences on that. We'll also be talking about how we can raise awareness of this problem and what goals should we really set and how do we think that we'll be able to measure that moving forward and see some of these changes actually taking place. So in your experience and in the 6 years that you've been an NHS nurse, including your training, what would you say racism looks like in the NHS?
So in my own personal training, I trained in Coventry, so that was how many years ago? 9 years ago now.
Okay.
And actually I didn't experience any racism that I'm aware of at all.
Yeah.
Then when I qualified and came to London, I sort of realised that actually when I looked at all the senior positions in nursing, no one was really black. There was no one for me to look up to in my nursing sector who was black at all. So not chiefs, not matrons. There wasn't even any band 6 like sisters who were black at all. So
and is band 6 like, is that, I'm assuming it's not so high, but still of a senior position?
From when you first qualify, that's the next stage of management.
Okay.
So you can have different levels of band 6s.
Yeah.
But for example, some of the girls I studied with are band 6s now. I'm still a band 5 because I've had my mat leave. But even then, that's another issue why I don't believe I should be one.
Yeah.
But yeah, so band 6 is just, it's not even that senior. And actually, I think a lot of people should be there.
And I mean, this is something that I think is across a lot of industries. So not just the nursing industry. So when I speak to people, one of the things I constantly hear is I don't have anyone to look up to.
Yeah.
I don't have anyone senior who looks like me, who can mentor me and guide me into potentially, being promoted to a more senior position, understanding their journey and their challenges so that you don't have to repeat the same journey that they did. So it's a shame that it is such a common problem, but I think the fact that I'm assuming, and I don't have the stats, but I research a lot of the topics I'm going to talk about, and I know that the NHS is made up by a significant amount.
So 44% are black or from other ethnic minorities.
And I'm assuming when we're talking about seniority, it's probably going to shrink down.
It's a lot lower. I can't remember the exact number now, but it's a lot lower.
I'll get those stats and I'll include it in the synopsis so that you can actually see the exact numbers that we're talking about. But
It's a
that
big
is
difference.
something that
Yeah.
we see a lot across the board.
Yeah.
That at the entry level you have high proportions of BAME workers, but then it just literally filters to
Yeah.
a very small percentage.
And also when you
talking
see
about
them
climbing the
in
ladder.
positions, it's normally like they'll be in charge of the ethnic mind, like
Yeah.
sorry, what is it, equality and diversity section or something like that,
Yeah.
rather than it's only sections that they think that black people have a right to be
Yeah.
a part of, if you know what I mean. It's not just like spread across the whole sort of sector. But yeah, another thing that I've noticed in the NHS racism wise is the healthcare, in a sense of, so I spoke to a group of doctors when this Black Lives Matter movement started,
Yeah.
and I asked, are they taught how to identify like rashes and different sort of illnesses in darker skin?
Yeah.
And he like outright just said no. Like they are taught on a white model, this is like what it looks like, and that's it, there's nothing else.
There's that doctor, is he in the UK?
I think he is in the UK. He was writing the book How to See It.
And it's crazy that it took for
2020.
the Black Lives Matter movement with George Floyd to push people to create a textbook that shows how sometimes fatal rashes can look on darker skin.
And as a black person in the public, you just assume that these doctors would know it.
Yeah.
I was actually, even as a nurse, I was quite shocked because we are taught to assess, but we're not necessarily taught in the same depth as doctors. So we're not taught how to look at rashes in any skin at all, actually.
Yeah.
That's something you learn as you go along.
Yeah.
But the doctors who actually train in this, they were just like, they are taught, but only for white people.
Yeah.
The same as, so with sickle cell, research-wise, there's a lot less research.
Yeah.
What I didn't know is that, so if you have a chronic illness, you get all your medication free. So like diabetics will get all their injections, everything free.
Yeah.
The only one that doesn't is sickle cell patients.
That's shocking.
So they have to even pay for their prescriptions, which
shocking.
they need all the time. Yeah, no,
Because
and I didn't know that until recently.
For anyone who knows someone who does have sickle cell, they're basically in pain
A lot.
24/7.
Yeah.
And the fact that they, you know, I'm not a massive advocate of medicine, as you know. I believe in natural medication. I believe in healthcare, lifestyle, and natural solutions to ailments, rather than thinking there's a pill for everything. But in the case of a sickle cell patient, they need medication.
And strong medication.
They need strong medication, and they need it on a consistent basis.
Yeah, and that's another thing. They were not taking their pain. It's really underestimated a lot. Because I work with children, I think it's a bit different because you have that sympathy for a child anyway. But then sometimes we get our teenagers who are like 16, 17, moving on to the adult sector, and then all of a sudden it's sort of like, oh, she's just being dramatic, and there's a lot of that you hear.
Because I saw there's a documentary on Netflix that was talking about, I can't remember what it's called, but it was just generally talking about health. It was in a hospital in New York, and there was a patient who had sickle cell. He was a boy, and he had come in because he was in so much pain, and the nurse had no sympathy. She basically is like, he is a substance abuser. And you know, he just got a prescription a few days ago, so you know, he's just coming here to get more, rather than actually seeing that he is someone who obviously needs it. There was very much, you're a substance abuser.
I even have parents of sickle cell patients who will not ask for stronger medication for their children because in the past they've been accused of wanting to drug their children up. So I had a patient about 2 weeks ago who was in so much pain, and he had a patient-controlled analgesia. So that's usually like, it could be like ketamine, fentanyl, it just depends what it is, so they can press it when they need it. He had that, they took it off of him for some reason, I don't know why. Then they put him on morphine, but the tiniest dose, and the mum was like, he's not even walking. And I literally just went in and I said to her, whether you think they're going to think that you're drugging your child up or not, you are the only advocate that he has here. And I suggest that if you see the pain he's in and you think he should have more, like, you just need to speak up. I was like, never worry what other people are thinking, because he needs you. And she sort of did agree. She was just like, do you know what, you're right, you're completely right. And she did ask for it, and he got it, and he got better, and he went home. Otherwise it would have been a longer process of this child being in pain. And of course you've got to be careful with addiction, obviously, but then you need a balance. You can't leave a child in pain, or an adult even.
And I if it was me, I would feel as though if I believed that I was going to be accused of substance abuse anyway, I might be a bit more deceptive in the way I try and get my medication.
Yeah. You try and stock up. And,
exactly.
Yeah.
So I did find that, again, in this documentary that I watched, that this boy had obviously felt that he needed to stock up or to get more, or maybe he was having an episode so much, but without taking those considerations on board, you know, it just is. I just don't think it takes into account the different issues and the different things that people who are dealing with a particular ailment that is more common in a particular group of community, and that group usually isn't listened to as much as others, then I feel that you would get deceptive behaviour.
But just even research-wise, there's not enough even around it for people to have a proper understanding. And so on within my hospital, we have like the oncology team, the diabetic team, we have the allergy team, the asthma team, and then we have the sickle cell team. That's the only team that's short-staffed, and it's not that they're short-staffed, they have no funding. So each position's meant to have 2 full-time nurses. Since I've worked there, they had 2 when I started, then the person left, and then they changed that post to part-time, and it's not been filled since, and the funding is not there. An allergy nurse left, and then they tried to take their funding away. The lady in charge pushed for it, got her funding back straight, full, like completely filled. So it's just sort of like, why? It makes me think, why is it that, especially because sickle cell is so serious, and it is so... It's life-threatening. Like, I've had patients who have died from sickle cell. Our cousin died from sickle cell when she was younger.
She did.
And I just...
I mean, we see people really dealing with this, and I think that without people having direct experiences themselves with family or friends that have to deal with a particular illness, I just don't think that sometimes you can have the level of empathy.
No.
And the fact that there isn't more research and funding put into particular illnesses, I think that you, like you said, you just wouldn't even know. So you know, like I mentioned, my daughter was unwell at a certain point, and I received fantastic treatment. But cancer is an illness that we all really are going to experience, whether it's a loved one or whether it's ourselves. As you know, the normal statistic, 1 in 2 of us are going to at some point in our lives have cancer. So you know, it's very difficult for me to use my cancer example as the industry standard, because everyone gets it, but on, you know, lupus, sickle cell, thalassemia, these affect the BAME community more than it does anybody else, and unfortunately it's just underfunded, and it really saddens me, because like I said, I have got total respect for the NHS, but there are just some things that they can't deny. There are some things that we just need to take a look at, take a step back, and come up with some real solutions. And every single time I find that there's a report, we're going to do a report to find out about things,
and then nothing actually happens.
Nothing really happens. So what are we going to do about it now? So as a patient yourself, how's that experience been?
So it's completely opposite. It's actually really positive for me as well. So, but my thing is, I'm a medical professional, so people are very careful how they treat me, and I always, not to like get benefits, but I always make it clear what I do before I go there, so that people are very careful what they do. And I always go to my hospital, so if I go with the kids, I get seen quite quickly and properly, and they take really good care of us. But me myself, obviously, when I got pregnant with Isaiah, I was seen by a midwife who brushed off all my results, actually. So I had protein in my urine a number of times. I gained... So when I got pregnant, I was 67 kilos. And then when I had Isaiah, I was like 110.
Wow.
And that's how much I gained. And obviously, I know that you gain weight, and I ate more, but that wasn't normal for me. And actually, I had preeclampsia, and they said that it must have been triggered after I had Isaiah. But I think if you look at all my urine results from before, and my blood pressure was high, and it was actually completely neglected. And I don't know if that is a thing to do with my race. I don't really, it's hard to say. But the woman was very much just like, oh no, it's fine. And I had to check my own results
I
myself.
had exactly the same experience. When I say exactly the same, obviously I didn't have preeclampsia or anything like that, but I basically gave birth myself to two of my children. Yes, there was a midwife who ended up being there as they actually came out of me, but I don't contract like normal people. I have irregular contractions. I could contract once and then nothing 10 minutes later. I can contract once and then I have another contraction a minute later. And this is all whilst I'm potentially in my first hour at the hospital. So I was treated as a hypochondriac. I was told that, and for both of my birth stories, I was only examined once, and that's when I arrived at the hospital. And when I was clearly in pain, I kept on being told, for my eldest daughter Adela, I was told this is going to take around 12 hours. So you've only got here, so honestly, don't worry. I didn't take an epidural. Queen Natural here was like, I could do it myself, but one thing I did need was gas and air, and even gas and air I had to wait for at least an hour because
Really?
apparently my pain just wasn't what it was. And
Wow.
so as time with my first daughter, as time went on, I demanded to be in the pool. So I got into the pool and they just kept on leaving me.
They didn't even really want to let you go in the pool, did
They didn't want to. That was with the second one.
Oh, okay.
So they just left me and my partner, and I was literally getting back to back contractions. And they would come in and they'd be like, "Oh yeah, no, it's fine, don't worry." And then it got to a point where it was so bad, and my body ended up pushing out my own child. All of a sudden, I couldn't stop the sensation to push. And when the head was coming out, my partner had to run out to the nurse and say, the midwife, and say, the baby's coming. And then she ran in and caught the baby, and Adela arrived. So when I had my second, I feel like I'm hijacking your interview here, but I really want to get this story out.
Yeah, no, you should.
Because when I had my second daughter, I was crazy. I went to a wedding when I was 4 days overdue. I danced this baby to come out.
Anyway, home.
On my way back from this wedding, I was driving everybody home, and then I started contracting in a car. So I got to the hospital pretty soonish. I was examined. I was 3 to 4 centimeters dilated, and I told the midwife as soon as I got there, I don't contract like normal people. I have fast deliveries. My first daughter was born in under 6 hours, and that was from the first twinge I had to the point where she came into this world. I had started having contraction at this point for over an hour. So I just said, this is my second baby. I contract really fast. I mean, I have babies really fast, and I contract irregularly. Again, 2 hours I had to wait to get gas and air. And then I got the gas and air, and within an hour I begged to go into the pool, and they said, you cannot go into this pool because this baby is not coming. Your last contraction was 10 minutes ago. And I said, yes, I understand, but I'm telling you, I think this baby's going to be coming soon. So I had to go into the bath, and I went into the bath and I put lavender in my water, and the midwife started laughing at me like, oh, what do you need all that stuff for? I was like, okay, that's really, really random. I want you to let me go in the pool. I'm going to have this baby. And then the pain got so much that I grabbed my partner and I said, tell them I'm going in the pool. And they said, okay, fine, we'll let you in the pool, but if it slows down your contractions, you're coming out. And I said, don't worry, that's not going to be the case. And by this time, it must have been about 5:15 in the morning, and the midwife, her exact words is, I'm not going to see this baby on my shift. I finish at 6 o'clock. Well, Maya was born at 6:01 in the morning, and same thing happened last time. I literally had to scream at my partner and say, tell them the baby's coming. And when they got there, well, at this time, luckily, the head hadn't actually come, but it was coming. And she said, oh my God, I just can't believe that you had this baby on my shift. And my thing I said to her is, because you never listened to me.
You've said it. Yeah. And it's not your first baby where maybe...
It's not my
but
first
even
baby.
if it is your first baby, you know your own body, and I think that needs to be really important.
And she hadn't ever had a child.
Yeah.
So when do we learn from our patients, and when do we dictate out as somebody else's experience from what you learn in a textbook. There's got to be a level of respect, there's got to be a level of empathy, and like I say, I don't think that's always the case when it comes to everyone. But if we talk about the 5 More campaign, they're an amazing organisation who have spearheaded the fight to look at why black women are 5 times more likely to die during
So it's actually
childbirth.
started by a girl who I went to school with. I didn't even realise till we both did Chloe's 8-minute 46 together.
Okay.
And then I realised it was her. So Atunike, she went to Bacon, so she knows me and Chelsea actually.
Yeah. That's our other sister, Chelsea. Shout out to Chelsea.
Chelsea, our baby daddy. Second baby daddy.
Second baby daddy.
Yeah, so she was just saying, so I think with her pregnancies, they were quite traumatic, but actually the normal amount of traumatic, like nothing really bad happened. But then when she started hearing about the 5 times more likely, she was sort of like, why is this? And I think it's stats from 2016. It was a while ago.
Yeah.
And it's just in that time nothing has been done.
Yeah.
And no research has even been done.
Yeah.
So fingers crossed what they're doing, because what they're doing is amazing. And actually what they're doing is just making black women aware of what to look out
and
for,
also using your voice.
Yeah, to be your own advocate and to not accept no for an answer. It's the same as anything. Like I always say, my word of advice is when you go to the GP, if you know your body and you feel unwell and they like sort of dull down your feelings, tell them to document what they have said to you, word for word, that you have said, I'm not happy with this, and they need to also document that they've said, I understand, but this is all I'm doing.
Okay.
Because
and that's good,
you have to cover yourself as a healthcare professional, and you'll notice they'll probably change their attitude when you tell them to do that.
because then they're being held accountable.
Yeah, exactly. Rather than writing down that this person came for this and I gave them this. You want them to write down exactly that they've refused to listen to what you've said. And you will see a lot of people change their attitudes towards a lot of things.
That's a good nugget too. So again, I'm happy to write some of these bits and pieces of advice in the synopsis, just so there's some real tangible takeaways for people to kind of have access to, and not have to always keep things in their brain. But you're right, I think holding people to account, making sure that you document your experiences, and people are acknowledging the fact that you have used your voice and it hasn't been listened to, it might make people think about their actions before doing it.
There's a framework in the NHS called clinical governance, where the NHS are accountable for everything that they do, and not a lot of people know about it, but it's sort of audited through a load of different things, and documentation is one of them. Yeah. So it's sort of like if you put a complaint in or something like that, the NHS are accountable, and that's why I push people that even if I'm your nurse and there's a complaint, I push people to complain, and formally and properly, because it's the only way that change is going to come. Because you can complain to the ward, but unless you go through, so there's a complaints unit called PALS, and if you go through them,
I know PALS.
And actually I did it with my maternity care, because at UCLH I couldn't get through to my midwife for like 2 weeks, and obviously I was pregnant with twins and at high risk. I had preeclampsia previously, I had my blood condition, and I just thought it was completely unacceptable. And from the time I did that, I got a direct number. I was able to contact them all the time, and I just thought this should be what everyone's getting. Why do I have to complain? But actually me complaining hopefully changed it for somebody else in the future. So I just think make sure you're complaining if there's a complaint, and also just holding people accountable, because that is what we're here for.
But I think again, raising awareness of some of the different channels that people can complain, where they can go to, who they can speak to, will help people have more of the confidence that when they have had a bad experience, that whether it's themselves seeing the improvement, whether they decide to have another child, or whether they go back in hospital for whatever reason, or making sure that you make that complaint so that you're helping others as well. Because I find that we live in a world that sometimes we think about ourselves and our experiences too much, rather than what we can do for others. Exactly. And as a mother, I think when you become a parent, your mindset changes, and you're so used to doing things for other people. So you kind of just fall into that pattern. But when that pattern can save people's lives, I
Yeah.
think that's when it becomes essential for us to take that responsibility on.
And I think it's just remembering also that healthcare professionals are normal people. They are humans. People make mistakes.
Yeah.
And even if someone has been maybe racially profiled you and treated you differently, then hold them accountable. But
Yeah.
I think it's important sometimes that experiences aren't always to do with race, and I think it's good to find the difference between the two.
Yes.
But doesn't mean that you shouldn't still complain and want
Yeah.
better, because
Yeah.
actually it's not like we just want only black people to be treated differently. In the healthcare system, we want everybody
Absolutely.
to be treated correctly,
Yeah.
with empathy, listened to, and just get the best outcome. And
Yeah.
that is the NHS's aim. So I think it's
Yeah,
important to
and
hold them to it at the end of the
Exactly,
day.
and the thing is, we've had really positive experiences with the NHS, but we can see that there's a problem.
Yeah.
We have evidence. You know, like I said, if you talk about the COVID-19 pandemic, black people are 1.9% more likely to die. Asian people are 1.8% more likely to die compared to their white counterparts. So we've said black women five times more likely to die in childbirth. So our experiences, we know it's not the benchmark.
Yeah.
So not everything is to do with race, but where race is part of the findings,
cannot be
when we're
ignored
looking at
at
the
all.
stats,
Yeah.
then we probably need to understand that people aren't making it up.
Yeah.
People aren't making it up, and just because I've had a good experience, I would never say
Yeah.
that you know, other people's bad experiences just doesn't exist.
So, sorry, this is just something that I wanted to also add about my experience as a nurse. This is just really quick.
Yeah.
So there's a dad. No, there's a dad who, I think he was Turkish.
Yeah.
So he was from Turkey, spoke
Yeah.
English, had an accent,
Yeah.
but as in I had conversations with him. Completely fine, actually really funny, had like banter, like same British banter as everyone. And then one of the nurses came and was like, "Dad, so we will organise," and I was just looking at her because I was like, I can't.
Awkward.
It's just little
Awkward.
things like that. It just made me think that is just so inappropriate. And actually he understands everything, and he had been there for about 2 weeks with his daughter, so she'd spoken to him before, and it made me think this whole time he's been speaking to you. But he even said to me that he felt that no one was listening to him, and everyone thought he knew better. They knew better about his daughter, who is severely disabled, but she was 14 years old. It was the first time she'd been to that hospital. He was like, I've been in her life for 14 years, and I've seen her go to different places, and you guys think you can tell me that I'm doing stuff wrong, or we're changing this, we're changing that. And he literally said to me, he was just like, it's because I'm not white English. He was like, that's why, because one of the consultants was really rude to him. So a lot of our children, if they were premature, they have chronic lung disease. So their oxygen saturation, so normal is 95% and above.
Yeah.
Theirs can be like, if you have a cardiac problem, you could be 75%, and that's normal for you.
Yeah.
Because this child was so disabled, one of the consultants decided to assume that when her saturations was 82%, that was fine.
Yeah.
And he was like, my daughter has saturations of 99 to 100, and that is her normal.
Yeah.
And she was just like, are you sure? And she was just being really patronising. And actually, he complained. He did a serious complaint and refused for her to see his daughter, which I completely agreed with.
Yeah.
And this doctor she's an idiot anyway. I don't like her. And she does this a lot. She's very intelligent and she's very clever, but it's almost got into her head too much that she doesn't listen to other people.
Yeah. Well, we know that now in healthcare it's not patient driven.
Yeah. No.
And that's a shame. But you mentioned is the trying to communicate. I will never forget, and this is actually off topic, but I'm going to put this story out because these are some of the things I've experienced. I've just never had a chance to really talk about. But I watched this show once, and they were I can't even remember what it was about, but all I remember is that there was a guy from Liverpool, and there was a guy from I can't remember. It was somewhere in Africa, maybe it was South Africa. But the guy from South Africa, I know I'm African, but I definitely understood him, and he had subtitles.
Oh, I see.
The guy from Liverpool was as Liverpudlian as you get. I didn't understand a word he was saying. And he had no subtitles. I've had the same when someone from Scotland as well. I mean, our sister lives in Scotland, again, and even that I did not understand it, but he had no subtitles.
Yeah.
So what I thought was a quite articulate African man was talking, there was they felt that the production team felt the need that there had to be subtitles.
Yeah, based on the fact that he wasn't British. Yeah.
So it's just little things like that.
Yeah.
That I think that puts people's backs up.
Yeah, definitely.
And impacts how they may be seen, treated, and trusted.
Yeah.
Because no one knows
Sorry.
our
ants.
I know. I've had flies on me. I've had ants on me. And the message that I would also put across is, you know your body, you know your children's body, you know what's normal, what's not normal. The people that you come into contact with, the healthcare professionals, yes, they have your best interests at heart, but they don't have the knowledge that you have. So speaking up about what is normal for you is essential for your survival.
Yeah. Just trust your gut and go with it, and be an advocate for yourself and your children.
Yeah.
I think that's the main thing. One thing I wanted to add about my birth story was, with Isaiah, after I got TTP, I am very grateful because it's really rare, really, really rare. And actually, it was a black doctor. I had lost my sight at this point, so I didn't actually know he was black until after. But he was the only one in that hospital who knew what was wrong with me. Nobody knew. They thought it was preeclampsia. Then when my platelets were dropping, they were sort of like, we just need to get her somewhere else because we can't deal with her because she's dying, essentially. Like, we don't know what's going to happen. Yeah. And then this doctor came and said, I think it's this rare disorder that is more common in black women, and it's triggered a lot of the time by pregnancy. And then they took me to UCH, and actually I got the best treatment ever. And they let Isaiah and Trevor move in with me, and it was amazing. But and research-wise, so I was a part of the trial. I don't know if you remember, I was a part of the trial, and it was called the Hercules trial, and I had to inject myself. And basically, it should stop me from ever going into relapse of my TTP, which is done so far. But then what I realised is TTP is common in black women when it comes to getting it randomly. But when it's hereditary, it's actually more white people. And I believe that that's the reason why there's been such a big trial. Because I thought, wow, I can't believe this disease that just affects black people is going so like worldwide, and it's all over in Belgium, everywhere, and they're properly releasing it now. So my consultant was saying thank you for being a part of it, because it went really well, and it's been what's the word? Basically, they've accepted it to use it globally everywhere. But I do think that is because there's the two sides of it, because I think the other way, it probably would be like sickle cell and just like lacking, and I maybe would have lost my life. I don't know, but
I suppose you have no choice but to think that way because of the other aelements that and how I tried to think positively, but but no, it's one of those things that I think anything from your own experience that you have learned to make sure that gets fed through to the right people. And is there some type of overarching body that takes people's, I know you've got pause for feedback, but is there like an overarching body that listens to patients? And if you have your complaint handled by pause, does that go into some sort of central repository and then looked at a more strategic level?
So clinical governance, sort of, there's 7 pillars of clinical governance, and that sort of covers everything. So they're the people, that framework is there to improve the service. I don't actually know how effective it is. And I know what it is, but I've only recently been doing more research about it. But it's supposed to be improving, and every single year.
But where do they talk about that?
Clinical governance. So that's the thing. It's not spoken about enough at all. And actually, even me as a nurse, we are not taught enough about it. And the only reason I know more about it is because I've gone to do that myself. And you're taught about it. I think maybe when you get in higher positions, I would know a bit more if I was in more of like a management position. But even so, we have a thing called day text. So any incident that happens on the ward, whether it's we've given wrong medication or whether it's a patient has complained about being treated unfairly, it all gets put into Datex,
Yeah.
and then the people involved all get contacted separately, and whether it's to do a reflection or if it's wrong medication is to go on like a course.
Yeah.
That usually happens.
Yeah.
I haven't been involved in a Datex that has included discrimination or anything, so I don't know what happens with that. But for example, when I first started, me and a senior nurse gave like, I think it was like 4 times the amount of morphine. Luckily it wasn't an overdose,
Yeah.
it just wasn't what was prescribed.
Yeah.
And then I had to go, me and her both had to go on training and be checked to be competent again to
Yeah.
give a controlled drug.
Yeah.
So I love the fact that that happened, but when stuff like that happens, at least you know it will never happen again.
Yeah.
But yeah, in terms of a bigger one, I'm not really sure.
Yeah.
And that's another issue because
Yeah,
I feel
I
like
think-
I should know.
So maybe
but-
maybe what you could suggest is a bit of a transparency report. So when it comes to dealing with complaints and if there are any particular structures that they have in place to look at discrimination, look at disparities
Yeah.
in death rates, healthcare. Maybe there needs to be a wider transparency report that gets made available so that people really and summarise, because nobody likes to read 50 something pages,
Yeah,
and I find that a
exactly.
lot of these
Yeah.
reports
It puts you
that
off.
people
puts you
people
off.
are not going to do that, so
Yeah.
you need to have something that people find easy to digest.
Yeah,
and,
and
it's
it
not
needs to be also, I was going to
overcomplicated.
say, the way, even when I've done my research, me being a nurse, some of the words used,
Yeah.
I have to go back and be like, wait, what do they mean by that?
Yeah.
And even in hospital, we know that when you're speaking to people who don't understand sort of medical lingo, that actually you have to just use simple terms,
Yeah.
because it can all be described like very simply, and I think
Yeah.
that's really important.
Yeah.
I know we're going over time now, but
Yes,
this is
we
an
are.
interesting conversation.
We are going over time, but I found it really interesting, to be honest, because there are things that I didn't even know existed, and I think the more people understand what they have a right to, what they can access,
Yeah.
the channels that they can go down when they believe they've received a substandard service, when they feel that they've been discriminated against, all of the things that make people lose confidence in such a fantastic service, who I do believe that their overall goals is to help people regardless of their race,
Yeah.
religion, sex, and again, I absolutely think the NHS is the best health service in the world.
Yeah.
But there are clear improvements that need to be made. So, like I said, I will put some of these resources that Olympia has mentioned today.
Can I add one thing?
You can
before
add
we
one
end?
thing before we end.
Sorry, just so I've been doing my own work around Black Lives Matters at work, and actually I just want to say that it's been received like excellently. So all the top consultants are really, really, really interested in improving themselves, and
Yeah.
actually a lot of them have said to me that before, when someone would tell them that they had white male privilege, they got offended, and they've actually admitted they're like, I see it now more than I ever have.
Yeah.
And they're just really keen to make a difference, and actually they've been like pushing on me, like, what can we do now? And I sent them a long list of reads and films to watch, and like they've watched them. And it's just been really well received. So I just want people to know that hopefully change is coming, and people are showing more interest than I've ever seen. So that's just my point. My positive point.
No, that's good because I do think that we're in a different time now, where these conversations, we're knocking on an open door rather than a closed door. So hopefully we are in a time where we see more permanent and sustainable change. So thank you again. Our kids are screaming in the
probably hear
background.
5 between us.
Yeah, so I think they know that we've gone over, because they were fine before we went 7 minutes over. But I will get this conversation up on my blog and on my YouTube, and please do share this with anyone who you think needs to hear it, especially if they're in the healthcare profession. If you know that they receive care, anyone who's pregnant, just share it with everyone. Because I think
thanks
there's
for
a lot,
having me.
Yeah,
I really enjoyed it.
there's a lot of nuggets, and if you do read my blog, you will see that I'm all about action, and I want people to share their experiences, but I'm all about what can we do. to make things better and improve things for the future generations. You know, between us we have 5 children, all of them are black, so we understand that we need to make a change, and we do not want any of them to inherit the problems that we are currently dealing with and our parents and their parents dealt with. So I'm going to leave it on that note. And yeah, so thank you for listening to my In Conversation With.